Hi and Assalamualaikum warahmatullahi wabarakatuh. So my name is Siti Anisafura binti Khairul Azmin. My ID number is AM2107008975. So before we begin our presentation, I want to share to you guys that our topic is mental health. So the theory that I use, which is cognitive behavioral therapy. So this is my first slide, which is shown that the big topic that I use. So, for my content in this slide, which is what is cognitive behavioral therapy. So that is for the first page. For the second page, which is technique that I use, and the last one is video. So, did you know what is cognitive behavioral therapy? So, for me, here we can see that cognitive behavioral definition is how negative thought can lead to negative feelings and action. As we know, if we have a negative thought in that day, we might feel lazy, we don't want to do anything, or we just want to lay down in the bed. So that's for the negative thought that can lead to negative feelings and action. But if you reframe your thoughts in a more positive feeling and helpful behavior, we might feel like, okay, today is the best day, so we can do anything we want. For example, okay, I think I want to finish my assignment for today. So it means we can finish our assignment for today. So the technique that I use for the cognitive behavioral therapy, which is role play. For example, as we know that role play is we just acting with the children. So for example, uh, the child is become a doctor, and then we as a teacher become a patient. So for the second technique that I use is relaxation and stress reduction techniques, which is if the child have a mental health problem, we can give them a time, which is take a deep breath and then push and then pull. So give them time to relax. And the last technique that I use is journaling and talk record. As we see that journaling and talk record is like we put the data in the file.
Hop on left foot. Hop on right foot. Jump like a frog. Walk in slow motion. March like a soldier. Hop like a bunny. I choose hop on left foot.
Okay, now walk back over to the top corner of the triangle. We're going to play the helpful thoughts game to help us learn how unhelpful thoughts can make us feel worse and have a negative effect on what we do, and how helpful thoughts can help us cope better with situations. I'd like you to pick an unhelpful thoughts card. That's the blue deck of cards. So pick the top card from the blue deck of cards and read the situation out loud.
You wake up from a scary dream.
Okay, now stand at the top corner of the triangle where it says thoughts.
Assalamualaikum warahmatullahi wabarakatuh. Next is art therapy. Art therapy is one of the therapy that can help children that having a mental health problem. Art therapy allows children to process the things that have happened to them and help reduce stress and anxiety as they work through these challenges. By providing kids a safe place to express their negative feelings and emotions, art therapy can help improve a child's mental, emotional, and physical well-being. Art therapy allows children to appreciate also to express their feelings and thoughts via the use of art. Art therapy involves drawing and painting their feelings with paints, markers, and chalk. Art therapy is a fantastic help for children who struggle to express themselves verbally. Art therapy encourages children and young people to better understand thoughts, feelings, and behaviors. By creating images and objects, children and young people can begin to see the thought and feeling they have inside and then be supported by the art therapists to better understand themselves and find solutions. Okay, this is the example of the activities for art therapy, especially for children.
What is play therapy? Play therapy is a form of therapy used primarily for children. That's because children may not be able to process their own emotions or articulate problems to parents or other adults. While it may look like an ordinary playtime, play therapy can be much more than that. A trained therapist can use playtime to observe and gain insight into a child's problem. The therapist can then help the child explore emotions and deal with unresolved trauma. Through play therapy, children can learn new coping mechanisms and how to redirect inappropriate behaviors. Play therapy is practiced by a variety of licensed mental health professionals like psychologists and psychiatrists. It also practiced by behavioral and occupational therapists, physical therapists, and also social workers. In addition, the Association for Play Therapy offers specialized training programs and advanced credentials for licensed mental health professionals, school counselors, and also school psychologists. So these are a few of benefits of play therapy, such as taking more responsibility for certain behaviors, developing coping strategies and creative problem-solving skill, self-respect, empathy and respect for others. For anxiety, learning to fully experience and express feeling, stronger social skill and also stronger family relationships. What is play therapy? Play therapy is a form of therapy used primarily for children. That's because children may not be able to process their own emotions or articulate problems to parents or other adults. While it may look like an ordinary playtime, play therapy can be much more than that. A trained therapist can use playtime to observe and gain insight into a child's problem. The therapist can then help the child explore emotions and deal with unresolved trauma. Through play therapy, children can learn new coping mechanisms and how to redirect inappropriate behaviors. Play therapy is practiced by a variety of licensed mental health professionals like psychologists and psychiatrists. It also
called play therapy.
Play therapy is a model of therapeutic intervention to use with children that helps them to develop their communication skills in a therapy situation so that they can express their needs, their wants, their wishes, and their feelings.
So next, we move to music therapy. Music therapy is a therapeutic approach that uses the natural mood-lifting properties of music to help children improve their mental health and overall well-being. It's a goal oriented intervention that may involve making music, writing songs, singing, dancing, listening to music, and discussing music. Music therapy is used to aid in physical discomfort by improving respiration, lowering blood pressure, improving cardiac output, reducing heart rate, and relax muscle tension. For mental health, this form of therapy is great for reducing stress, common negative side effects such as emotional and behavioral problems. There are several types of music therapy, such as analytic music therapy. Analytic music therapy encourages children to use and improvise musical dialogue through singing or playing an instrument to express their unconscious thought, which they can reflect on and discuss with the therapist afterward. Next is vocal psychotherapy. In this format, children can use various vocal exercise, natural sounds, and breathing techniques to connect with their emotion and impulse. This practice is meant to create a deeper sense of connection with their self. Lastly is the Boni method of guided imagery and music. This form of therapy uses classical music as a way to stimulate the imagination. In this method, children will explain the feeling, the sensations, memories, and imagery that they experience while listening to the music. So, lastly, is benefit of music therapy. The first one is music therapy can improve children mood, which is when children listen to happy and enjoy the music, they will overcome their mood to the good mood. Next, will increasing frustration tolerance. Mental health will challenge can cause frustration to increase some situation. Many times when frustration is at its peak, that is when many mental health symptoms start to exhibit themselves and become too overwhelming to handle. Through music therapy, one can work on building frustration tolerance in controlled environment through something creative in nature. For example, a music therapist may engage the children to hear a music, relaxing music, or enjoying music. Next, music also can help children to lessen feeling of isolation. So it will avoid the children feeling alone. Okay, and then from music, the children will developing positive emotional behavior. If they if they learn happy music, they will be happy. If they listen to sad music, they will be sad. So for the therapies, basically the children will listen to a enjoy music or a relaxing music. So that's all for music therapy.
Next is animal assist therapy. This is for children who have the problems of mental health. Meanings of animal assist therapy. Animal assist therapy is an alternative or complementary type of therapy that includes the use of animals in a treatment. Animal assist therapy involves treating or spending time with animals during goal-oriented therapy sessions. These goals can take the form of physical, emotional, educational, and or psychological therapy. There are several animals that are suitable for use during this therapy. First, horse, second, cat, third is rabbit. Example activities of animal assist therapy.